Hi everyone, Brian from MedicapList.com. Today's video is going to be about Medigap enrollment period for people turning 65. Actually, Medicare enrollment period also. I sat down with a woman the other week who explained to me that she was turning 65 in about 5 months, and she called 1-800-MEDICARE, the Medicare hotline, and she was unable to sign up. So we called the hotline back, and they had told us that you have to be within 3 months of turning 65 to apply for your Medicare A and B card. So we waited a couple weeks, and she called back and was able to at least put her paperwork in. At that point, she could sign up for her Medigap plan. Now, the funny thing is you can sign up for a Medigap plan 6 months prior to your 65th birthday, but it really doesn't make any sense if you can't get your Medicare Part B, at least enrollment, to sign up for. So I don't know why that is, but I don't know why a lot of things happen with Medicare. In any case, health insurance options for people turning 65 or are over 65 are, you have your HSA, which is your health savings account. You can, if you have a corporate corporate health plan, you don't have to get rid of that health plan if they're paying for it and it's free of charge, or if it's minimal, it costs you $100 for your whole family, maybe 3 or 4 people. Then you probably don't want Medicare. At least you don't want Medicare Part B, unless the company's making you get on it. So that's if you have good health insurance, you might want to deny your Part B, or yes, your Part B, so that you don't lose your enrollment period, your initial enrollment status. So once again, Medicare Part B is the big kicker, the question that you have to ask yourself: do I want Medicare? And if you don't, you want to make sure you don't get your Part B. If you decide you want Medicare, what you need to do is 3 months prior to your 65th birthday, make sure you sign up. You can do it through a Social Security website. You can do it through the Medicare website, which will bring you to the Social Security website from what I remember. And you sign up for your Medicare Part A and B, which your Part A will be, if you have your Medicare credits, you won't pay anything, and your Part B will be, depending on your income, will cost you something. Then you'll call and look around for your either Medicare supplement plan or your Medigap plan or your Medicare Advantage plan. Decide which route you want to take with that. And then, of course, you want to pick your prescription drug plan. If you get an Advantage plan, you'll have to stay with that company that you got the Advantage plan from. You have to get the same company for a prescription plan. But if you get a Medigap plan, you'll be able to choose different companies for that plan. The best way to do this is to get a Medigap agent from a company like MedicapList.com that can take an hour and explain it to you, explain the different companies, explain all the different prices, because in the end you're not paying anything more for using that company. A lot of people think, oh, I don't want to go to this company because they're going to overcharge me, and I can go directly to the different companies, such as I'm not going to mention any names, but that's not the way it works. You're not going to pay anything more by going through a broker like ourselves, because what we do is the companies send us out what their prices are, and we just basically, we're a middleman. We just say, hey, here it is. And you say, well, how do you get paid? Well, the companies pay us, because they know a lot of people come to us so that they can get a list of different companies. We can give you a list of 25 different companies with different prices in 3 minutes, whereas if you were to do it on your own, it might take you 3 years to get those prices, to call around. So in any case, that's your best bet for it. But turning 65 is going to be your most difficult time, because most of your friends might be around 65. Maybe they're not on Medicare. They don't know anyone that can explain this to you. You don't know if you want a Medigap Plan F or if you want an Advantage plan, depending on what state you live in. The prices could be different. And of course, choosing a prescription drug plan can be a nightmare for people who are turning 65 also. So that's something that we can also help you with, which is sometimes it's more important than the actual Medigap or Medicare Advantage plan. That might be simple for some people, and the prescription drugs is, they might have a list of 15 drugs and it takes a long time. So I hope that helped you, and you can click on our link, medigaplist.com, and check out some prices from some companies that you've heard of and some companies that you haven't heard of, and hopefully we can help you there. Take care. Have a great day.